Good evening. Welcome to our nightly live stream, where we've got 7 days left until the general strike against Congress, against partisan politics, against the status quo. Now, you can join the general strike next week on October 15th by participating in the National Fast for Peace, or by using the hashtag Fast for Peace on Twitter and signifying your willingness, your desire, to demand that Congress pass the blueprint for a better America immediately, if not sooner. And when enough Americans take up this demand and pledge their votes to come together as a bloc committed to doing this, 3.5% of Americans united can control the balance of power in Washington, D.C. That gives us leverage over Congress. That gives us a way to force them to act and actually do something for the American people. Tonight, we're going to start talking about Title IV, promoting the general welfare and how we can improve things in America. Before we do that, let's go ahead and start off with the preamble to remind us of our duties as Americans. We, the people of the United States, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity, do ordain and establish this Constitution for the United States of America. Now, those are our five duties, and we've already covered establish justice and some major criminal justice reform, how we can ensure domestic tranquility by we the people working out a truce on guns and abortion, how we can provide for the common defense by downsizing the military industrial complex more in line with what the framers had in mind. And then tonight, we're going to get into Title IV, promoting the general welfare. Now, welfare, if you look it up in the dictionary, has a very specific meaning. You know, we talk about when we use the word welfare in the 21st century, we might talk about like corporate welfare or welfare programs. But if you look it up in the dictionary, it has a specific meaning. Ones that the framer that was in common usage at the time. Noah Webster, one of the supporters of the efforts of the founding fathers, they was the author of one of the first dictionaries. And so welfare means health, happiness, prosperity, well-being. These are the things that we as Americans have a duty to promote. And so that is what this section is going to get into. How do we promote those things? Last, just one more update. As my own personal commitment to this effort, I've been observing the Fast for Peace for the last 2 weeks. It's been more than 2 weeks since I've eaten, and I'm going to continue through October 15th. And so I invite you to join me for the last 24 hours, because enough of us can de-escalate the 2022 midterms. We, the people, have the power. We just need a better way to organize, and that's the American Union. By unionizing as voters, leveraging our votes, not behind one political party, not behind any faction, but instead by pitting challengers and incumbents against each other and saying, look, get this done before the election, incumbents, members of Congress, and you can get our votes, Republican or Democrat, we don't care, just solve some problems already. But if they refuse, then the challengers have the opportunity to earn the American Union endorsement and replace them. This by having a very clear metric on what exactly we want Congress to do. We can change the way politics works. We can crowdsource functional government. So tonight, let's take a look at starting with section 401. 401 is the findings for Title IV, and I'm just going to go ahead and read those into the record. Congress finds the following. 1, Americans have a constitutional duty to promote the general welfare, and Congress has an additional duty under Article 1, Section 8 to provide for the general welfare. 2, welfare is defined as health, happiness, prosperity, well-being, and a logical way to increase access to health care is to decouple employment and health insurance by offering a public option for insurance. This will further increase happiness and prosperity by freeing employees to change jobs or start their own business without risking loss of health care. 3, to improve the health and happiness of families, America should join the ranks of the other industrialized nations in offering paid family leave. 4, instituting universal basic income through the American Union Jobs Program will improve the lives of the 140 million Americans who are living in or near poverty, including 10 million children, by ensuring basic economic security, and improve happiness for all Americans by reducing wealth inequality. 5, universal basic income will also improve prosperity, putting billions of dollars into local communities, creating new customers for small businesses, and providing the startup capital for entrepreneurs to launch their own businesses. The purpose of this title is to promote the general health, happiness, and prosperity of America. All right, that's it for Section 401. Section 411, establishing a public option for health insurance. Now, so the first question is, what is a public option? What does that mean? And this is where people would be able to buy a health insurance plan through a government-run program. It's an option, so you'd still have the option of buying from a for-profit private insurance, but it would be a choice. Now, some of the benefits from taking the public option is that it is a nonprofit that doesn't have taxes to pay and has economies of scale. Government programs like Medicare have lower administrative costs. According to the 2021 annual report of the boards of trustees of the Federal Hospital Insurance and Federal Supplemental Medicare Insurance Trust Funds. Yeah, that's a mouthful. Medicare's in administrative expenses were $4.5 billion in 2021, which may sound like a lot, but is only 1.1% of their total costs. Put another way, 98.9% of their expenses went to benefit payments. Now, recently, I got a letter from my health insurer saying that in 2021, they had spent about 72% of the premiums on actually issuing benefit payments. So compare 72% to 98%. And because of the Affordable Care Act, they were issuing me a refund and all of their insured, everyone who had paid premiums, to bring that percentage up to 80%. The Affordable Care Act required that insurers spend at least 80% of their premiums on actually providing health care. So those are some of the benefits to a public option. Now, sometimes you will hear people complain that, oh, well, this would not be fair to make private insurers, for-profit insurers, compete with a government-run plan. That's not fair. But on the other hand, you also hear people complain that, oh, the government is incompetent. They can't do anything right. Everything they do costs too much. So you can kind of pick and choose. You can see that these two arguments are mutually exclusive. Either the government is horribly inefficient or the government is too efficient. In any case, we know that our current healthcare system, that we spend more per capita than any other nation on the planet for our health insurance. And we've got tens of millions of people who don't even have health coverage. So a new option, a change of plans. We need a new way to look at things. And the polls support this as well. There was a March 2021 survey by Politico. They found 68% of voters supported a public option for health insurance, including 56% of Republicans and 80% of Democrats. The government is there as the provider of last resort for health insurance, right? If you show up at an emergency room, the government says, look, we've got to make sure that you have health access to health care. They're there as the last resort, the last provider of last resort. But they don't have to be the competitor of last resort, allowing the government to compete in the marketplace with for-profit insurers will help keep them honest, will make them sharpen their pencils and find ways to provide better, more affordable service instead of what we have right now. So a public option for health insurance would be portable. Right now, we've got this problem where many people, their insurance is tied to their employer. And so maybe you're not happy and you want to change jobs. Well, now you're risking your insurance. Now you're risking your access to healthcare. At the start of the pandemic, we had 5 million Americans who lost their health coverage because they lost their jobs through no fault of their own. You know how many other industrialist countries went through that? Zero, none of them. This was an American problem. We know that what we do right now does not work, that there are better ways. And so establishing a public option for health insurance would give people a portable option, a national option. So you want to move, so that you have one provider. Right now, health insurance is generally governed by the states. So each state has its own controls how the health insurance market works in their state, which has a lot of, when I was in the legislature, I served on the Commerce Committee, and we did all the banking and insurance regulations. And so, this can be a good thing that somebody local is keeping an eye on these kind of things and making sure that the insurance companies can at least on paper justify premium increases and things like that. And that if you have a complaint, you have someone in your state to complain to, as opposed to perhaps if you live in Florida and your health insurance is by a California company, trying to call someone across the country and get them to worry about the problems you're having would be much more difficult. So there are advantages to the way that we have insurance is regulated now, but having one national provider offering a public option would give people greater freedom to move around the country. All right. So our legislation that establishes a public option for health insurance, it adds a new section to the Affordable Care Act. And what it says that beginning in 2024, the Secretary of Health and Human Services would begin offering this option through health care exchanges only. So if you're familiar with the healthcare marketplace, that's how you would buy these things. Let's I'll go ahead and share my screen here, and we will take a look at what exactly we're doing here. All right, here we go. Establishment of a public health insurance option. All right, so we're adding a new section 325, beginning in 2024. Enrollment in a public option is voluntary. Nothing in this division shall be construed as requiring anyone to enroll in the public option. Enrollment in such option is voluntary. So anytime we talk about making changes to the current system, people like to raise the specter of socialism, or that government is going to make your medical decisions for you. You're going to be forced into this plan. And there are a lot of advantages to a single payer universal healthcare system, because again, the one that we have now is letting tens of millions of people fall through the cracks. But in this case, a public option is strictly voluntary. You want to buy your insurance somewhere else? Go ahead. All right, offered through exchanges, as we talked about, and you've got the bronze, silver, and gold plans, similar to what we have now. Premiums, premiums will be, where is it here? We got state councils, data collection, treatment, treatment of the option. This will be treated as a qualified health benefits plan, offering exchange participating health benefits plan. All right, so premiums. The Secretary shall establish geographically adjusted premium rates. So somebody in New York might not pay the same as somebody in Kansas or someone in Delaware. They'll be able to change those, but it'll be done in a level to fully finance the cost of health benefits provided by the public health insurance option and the administrative costs. So this is not something that is going to be paid for by general tax dollars or other parts of the budget. This is a straight self-funded thing. We'll collect premiums and pay out most of those premiums to provide health care. That's what the public option will do. There will be, for startup funding, there would be a $2 billion advance from the Treasury, which the program would pay back over 10 years. And no bailouts. No case shall the public health insurance option receive any federal funds for purposes of insolvency in any manner. This is a self-contained program to create the public option. And as I said, this will begin in 2024. The fees will be based on the Medicare, current Medicare reimbursement rates, plus a 5% incentive. And we will negotiate for prescription drugs. We're going to talk a little bit more about this in section 414, I believe. Provider network. Where we got participating providers. So in general, healthcare providers, including physicians and hospitals that participate in Medicare, would automatically be participating providers in a public health insurance option, unless they opt out. They can opt out. They don't have to accept this if they don't want to. And they'll have a few months before the plan starts January 1st, 2024 to opt out. And says there will be no penalty, and the Secretary shall include how they could opt back in if they wanted to, and that there would be an annual enrollment period where providers could decide to opt back in. But we're going to also encourage a modernized payment initiative and delivery system reform. So Secretary can look for better, more efficient ways to make these payments so that more premium dollars go to providing healthcare services. Some of the requirements, some of the things that you can do. Let's see if we've got a list here. They may include patient-centered medical home, and other care management payments, accountable care organizations, value-based purchasing, bundling of services, differential payment rates, performance or utilization-based payments, partial capitation, and direct contracting with providers. So looking for ways to be more efficient. And the requirement is the Secretary shall design these things in a manner that does all 5 of these things. seeks to improve health outcomes, reduces health disparities, including racial, ethnic, and other disparities, provides efficient and affordable care, addresses geographic variation in the provision of health services, or prevent and manage chronic illnesses. I said does all 5 of those things, but actually it's an or. So it's got to hit one of those 5 things. But it also has to and promotes care that is integrated, patient-centered, high quality, and efficient. All right. Okay, and then provider participation. We've already talked about this. So special rules for the Indian Health Service that that the requirements under these requirements shall not apply to healthcare professionals employed by the Indian Health Service or any healthcare professional who is employed to provide healthcare services. So ease the regulatory burden on the Indian Health Service. Make sure that, going back to addressing racial disparities in healthcare. Okay, we got payment terms. So we got preferred physicians, those who agree to accept that payment rate that we established. For those non-participating but non-preferred physicians, they agree not to go over 15% for the in-network cost sharing plans. Application of HIPAA, Health Insurance Privacy, Security, and Electronic Transactions. So HIPAA still applies to any information, health information that is all the HIPAA requirements that apply to other healthcare plans would apply to this too. You can see that again in subsection H. And we got some boilerplate, changing some references to the health insurance for the health insurance option, adding them to the list of the code in a few places. All right, that's section 411. Section 412, repealing eligibility restriction on subsidies. And that is, let me talk about these next 2 sections. Section 413, repealing large employers' health insurance mandates. And both of these are just repealing a section of the existing law. So right now, the way that the system works under the Affordable Care Act is that if you have job-based coverage, you might be able to change to a marketplace plan. But if you do, you almost certainly you won't be eligible for a premium tax credit or for other savings. You'll pay sticker price. As long as that job-based plan is considered affordable, which almost all of them are, and meets minimum standards, which they pretty much all do, you don't qualify for savings. So again, the system is set up in a way that ties your health insurance to your employer. And you want to give people freedom to be able to change jobs without losing access to their health insurance. And so that's what the public option would do. So what it does is it repeals that restriction, where right now, if, for example, you work at McDonald's and McDonald's offers a health insurance plan that's not that great, and you want to buy a better one on the marketplace. Well, you can do that, but then you, whose income is, within, I forget, I want to say within a couple hundred a certain percentage of the poverty line, as long as you're employed, as long as your employer offers that plan, you would not be able to get a subsidy. If you worked someplace that didn't offer that subsidy and made if you worked someplace that didn't offer insurance and made the exact same amount of money, you would be able to get a subsidy to help for the cost of your insurance. Or if you were, So this section 412 would repeal that restriction. Section 413 is repealing the large employers' health insurance mandate. And again, so the Affordable Care Act, it requires that employers with 50 or more employees, full-time equivalent employees, which means 30 hours a week or more. It requires that they provide health coverage to at least 95% of full-time employees, and it sets a minimum baseline of coverage and affordability which is why they almost all meet it, because the Affordable Care Act requires it. And if they refuse to do that, or whatever, their coverage doesn't meet the standards, then they face annual penalties if any of their employees end up qualifying for those premium tax credits because the plan that they offered didn't meet the minimum standards. And in that case, those penalties are, for 2022, are $2,750 per full-time employee after 30 employees. Or that's if you don't offer the insurance, or if you're offering as an affordable or providing minimum value, then it's $4,100 for any employee who goes to the exchange and qualifies for a subsidy. And so you're creating a disincentive for employers, right? If you're a small, medium-sized business and you've got 60 employees, whatever, and maybe you own a McDonald's and you've got 60 to 70 employees. Well, if you can keep the number of full-time employees 30 hours a week, if you can keep that under 50, then you don't have to deal with the hassle of providing health insurance to your employees. So you've created an incentive for employers to cut people's hours, to keep that number low so they don't have to deal with this. Because that's what this public option is really about, is taking the burden of providing health insurance off of employers. Nobody goes into business because, I hope that I'm going to be able to provide health insurance for my employees. That's not why people go into business. They go in because they have a good or goods or services or something they want to offer to customers. And they're saddled with this burden because of the way that our system is set up. They're saddled with this burden of dealing with health insurance. And so a public option will take that burden off of businesses so they can focus on just serving their customers. They can focus on what they want to be focusing on. And so that's how we can reduce regulations, reduce burdens on businesses, and improve the health, happiness, and prosperity of employees, of everyone, by offering the health insurance, public health insurance. All right, moving on to section 414, negotiating prescription drug prices. So this was in the news a few years, last month, I believe, with the Inflation Reduction Act, because this was a big deal that Congress had passed something to allow for negotiation of prescription drug prices. Do you know what that actually said? It said that 3 years in the future, that Medicare Part D could negotiate for 5 prescription drugs. The 5, maybe it was 10. Anyways, not a whole lot. I think it was 10. And so, well, what about all the other drugs? Why not today? Why is this set up? And I can tell you that one of the reasons might be that the pharmaceutical companies spend an awful lot of money lobbying Congress to stop these kind of provisions that would reduce the cost of prescription drugs from becoming law. In 2018, Citizens for Responsibility and Ethics in Washington, they reported that, quote, the industry's biggest trade group has also increased dues for its members companies by 50% in order to raise $100 million for an influence campaign to stave off possible pricing regulations by U.S. lawmakers. All right, $100 million for 535 members of Congress. That's $187,000 per person to persuade them not to legislate, not to reduce the price of prescription drugs, which is an idea which is incredibly popular. Last October, Kaiser Family Foundation found that 83% of voters supported this provision. This has been a popular talking point for years. And now that a little bit has been done, now maybe they don't feel like doing anything more. We can do better. The Blueprint for a Better America, Section 414, will do better. And how much better would it be for the Americans? Well, the Nonpartisan Congressional Budget Office, they estimated that allowing Medicare to negotiate prices would save the government health plans $450 billion over 10 years. So let's think about this for a second. The pharmaceutical companies are willing to spend $100 million because they're going to generate an extra $450 million in extra profits. Because why? Because Congress won't fix this problem. We all know that government is overpaying for these prices. It's these prescription drugs. And in fact, they wrote it into the law that we would pay 106% of whatever the average market price was for these drugs. So that whatever everyone else is paying, we're going to buy in bulk, which the federal government buying in bulk, as one of the should, you would think, get like a quantity discount, but instead we're paying above average prices on purpose. Congress wrote that way. That was $100 million well spent. We can do better. This is why we, the people, can crowdsource better government, better policy ourselves, because the healthcare companies can't spend $187,000 per member of the American Union to persuade us that we shouldn't fix pharmaceutical prices. All right. Let's go ahead and take a look here real quick at what exactly Section 414 does. Remember how I mentioned that this new provision that they passed in the Inflation Reduction Act, how it would allow Medicare Part D to negotiate for prescription drugs? That's good, obviously, but what about Medicare Part B? So Section 414 will require negotiation for both. Negotiation for drug prices. I want you to see, this is what you can see, this struck out text. This is what the current law says. Non-interference in order to promote competition. And carrying out this part, the secretary may not interfere with negotiations between drug manufacturers, may not require any particular formulary or institute a price structure for the reimbursement. So this is non-interference to let drug companies charge whatever the heck they want. All right, that gets struck from the law. And instead, notwithstanding any other provision, the secretary shall negotiate for the prices of these things. No change in rules for formulary. And nothing in this. And so shall negotiate. We can cut drug prices by billions, tens of billions of dollars a year, including by negotiating under Part B, again, not in the Inflation Reduction Act. Negotiation for prices for drugs and biologicals. If you look up this definition, it means the same. It's one phrase that means the same thing. So drugs. And so, yeah, so same thing where we're requiring the secretary shall negotiate better prices for these things because, again, the government is buying in bulk. So let's go ahead and take advantage of that to lower the costs of the government. Again, $450 billion over 10 years. That's money that should be better spent elsewhere. There's so many other problems in this country, and instead, it's a $45 billion a year subsidy to pharmaceutical companies. It's just wrong. We can do better. All right, that concludes subtitle A. Let's move on to subtitle B, which is establishing a paid family leave program. And most of this comes from S-248, the Family Act, introduced by Senator Gillibrand of New York. It's the Family and Medical Insurance Leave Act. I'm not sure where the Y in family comes from in the acronym, but otherwise it's pretty good. And so section 421 is our findings here. Congress finds the following. 1, the United States is one of only a handful of nations that does not protect new mothers by providing paid maternal leave, which is a demonstrated way to reduce the infant mortality rate. Our rate in 2018 was 5.7 deaths per 1,000 live births, or more than 65% higher than the European Union average. Now, if America's infant mortality rate could be brought down to the average of the American Union, the lives of an estimated 9,000 newborns would be saved annually, or one baby of every hour, of every week, of every month, of every year would live to see their first birthday. Now, paid family leave will better enable both men and women to take care of family members in need, strengthening families and reducing the public costs of care. What is the purpose of this subtitle? To improve the health, happiness, and prosperity of working people by empowering them to take time away from work to provide care for a family member. This is good not just for the employees, but also for employers. In May of 2019, Time reported that, quote, using data from nearly all employers that existed in California between 2000 and 2014, because California initiated required a paid family leave. Research in the California Employment Development Department found that the average firm had lower per worker wage costs and lower turnover rates than it did before a paid parental leave law took effect. Look, this makes sense. This is a win-win situation, which is why just about every other country on the planet does this. America, we are an outlier. What we're doing is not normal by global standards. So we can establish 18 weeks of paid family leave. Section 422 gets into the definition. It is pretty basic stuff. I'll go ahead and share my screen here and we'll take a quick look. Caregiving days, the commissioner's Social Security. So initial waiting period. The initial waiting period means a period beginning with the first caregiving day of an individual and ending after the earlier of the fifth caregiving day of the individual occurring during the benefit period, or the month preceding the first month of the benefit period. So you can kind of think of this as like your deductible, that you've got to do a little bit of caregiving first before you actually start getting paid from the paid family leave. Qualified caregiving. All right, this is any activity engaged in by an individual other than regular employment for any reason that they would be entitled to leave under the Family and Medical Leave Act of 1993. So we have this existing law, the Federal Family and Medical Leave Act of 1993, that says for a number of reasons, you can take time off for family and medical leave, and your employer can't fire you for it for 12 weeks because it's unpaid. And because it's unpaid, about a quarter of women go back to work within less than a month of giving birth, when, again, so much better for babies and mothers, for families, to allow mothers and newborns to spend time with each other. 90-day limitation period. This is the this is up to 20 days per month that you can 20 days. So 20 days per month, like if you had 4 weeks in a month, five days per week times 4 weeks in a month, 20 days per month. So 90 days works out to 4.5 months, about 18 weeks. And it starts after that initial waiting period. All right, that's section 422. Let's get into section 423. This is the Office of Paid Family Medical Leave, headed by a deputy commissioner in the Social Security Administration. And so this is the bureaucrat that runs the show. And so we've got his duties listed in here. It's all pretty standard stuff: hiring, regulations, determining eligibility, determining benefit amounts, keeping records, preventing fraud and abuse, providing information on request about these information, providing employers a notice informing employees of the availability of such benefits, an annual report, and tailoring cultural and linguistical competent education and outreach towards increasing utilization rate of benefits under the sectioning. I'm not sure what that means exactly. Just multilingual, I think. All right, but that's yeah, that's the basics of the bureaucratic stuff. All right. Now we're into 424. This is the insurance benefit payments. So, and so we cover in subsection A who is eligible. Every individual who's insured for disability insurance benefits under the Social Security Act. So those are the people who are eligible, have earned income from employment. This includes self-employment income during the 12 months prior to the month in which the application is filed. So you have to have worked in the last year and filed an application and engaged in that qualified caregiving that we talked about, or anticipates being so engaged, as if you're pregnant and you're ready to give birth, can't actually care for the baby till it comes out, but you anticipate being so engaged. Shall be entitled to a benefit for each month, not to exceed 90 caregiving days per benefit period. All right. Benefit amount in which the individual is entitled shall be an amount that is equal to the greater of the lesser of 1/18 of the wages and self-employment income of the individual for the calendar year in which the wages and self-employment income are the highest among the most recent 3 calendar years. All right. So look back at the 3 most recent calendar years, and whatever your highest income level was, that's the level that your benefit would be paid at. And that benefit would be per month 1/18 of that. So that works out to 2/3. So you would get 2/3 of your highest income for the last 3 years. That and this is the greater of either that or the minimum benefit amount determined under paragraph 2 multiplied by the quotient, not greater than 1, obtained by dividing the number of caregiving days of the individual of such months. Okay, so minimum, how do we figure out what the minimum benefit amount is? The maximum shall be $3,600 per month. That's the cap for 2024. This will be indexed to inflation, and a minimum of $600. So whatever your income level was, it'll fall between, for the 2024, fall between the benefit payments will be between $3,600 and $600. For individuals who become, so after 2024, it is indexed to inflation. So both the minimum and maximum will increase. All right, we've got, okay, this is our 12-month. So the benefit period is 90 days per 12-month period. So spend 6 weeks taking care of a sick family member at the beginning of the year, and then later on you have a baby and you take your other 12 weeks. Those are it's 18 weeks per year, per calendar year. I'm sorry, not calendar year, but 12-month period. What else we got? Benefits be coordinated with state benefits. Like I said, the benefit period is over a 12-month period. The application shall include a statement that you have to affirm that you're actually engaging in that qualified caregiving. Ineligibility. All right, disqualification. If you're on permanent disability, then you would not be eligible for this program. Remember, we said that being eligible for disability was one of the qualifying events. Or if you have made fraudulent statements trying to get benefits, you would also be disqualified for a 1-year period following the date of that conviction. Subsection F gives us the eligibility determinations and an appeals process. If you don't like if you get turned down, here's how you can appeal, and the commissioner can review it. Burden of proof. Generally, an application should be considered presumed to be true and accurate unless the commissioner can demonstrate that something is false. And G, this clarifies that it doesn't preempt or supersede. Remember, we said California had a program. So any other state things, this can go right alongside them. And greater benefits allowed. That if you're part of a labor union and you've got a great deal in your union contract, you can have a better benefit program than what this is. This is established as a minimum. Subsection H, this prohibits employers from firing or discriminating against people asking for family leave. And if they do, you can bring a civil action. Civil action for damages and attorney's fees. Let's see. The commissioner can also bring a civil action as well. There's a special rule for railroad employees. Because railroad employees sort of have their own little carve-outs in some of the laws. So make sure that it applies to them as well. And determination of whether an activity continues qualified caregiving. So it's a basic definition. The term spouse includes the individual's domestic partner. Son and daughter includes a son or daughter of the individual's domestic partner. Domestic partner basically means another individual with whom the individual is in a committed relationship. That's any two individuals at least 18 years of age in which they are the individual's sole domestic partner and they share responsibility for a significant measure of each other's common welfare. If you say that you are in a, and specifically includes individuals of the same sex, or ones that are granted legal recognition by the state or political subdivision. But basically, if you say that you're a family, then you're a family. And then just some bookkeeping stuff here on Social Security Act provisions. And again, this will be effective January 1st, 2024. All right, so that's how the paperwork process works. Just pause for a second here. So these benefit payments, they can be used when the employee is severely ill or seriously ill, or if they have a child, or if they're pregnant, if they need time to care for another family member that is seriously ill. Again, we could look up the Family Medical Leave Act, and it also allows for specifically for military caregiving and for as well as for leave purposes. And the way that this was developed is it builds on lessons from state, that some of the state paid leave plans that were developed in California, New Jersey, and Rhode Island to help ensure that caregiving time is affordable for lower wage workers. And these benefits would be portable. So as long as a worker has paid into the system and is earned something in the last 12 months and is engaged in eligible caregiving or has a serious illness, then they could receive Family Act benefits, even if they worked somewhere else previously. So, all right. Section 425, it creates a trust fund for these payments. Let's share the screen here real quick. So yeah, trust fund is established and we're going to make deposits. The trust fund is established. We're going to make deposits to it in the next section with the taxes. So it is filled up with these taxes that we're going to define in a minute, and gets some startup funds for the first until September 30th, 2026. Basically, it can get an advance from the U.S. Treasury in order to get things rolling. Anything that does come from the U.S. Treasury and that under that subparagraph would have to be repaid within 10 years. This will be managed under the Social Security Act, and the benefits shall be paid under that we described in the previous section shall be made from the Family Medical and Leave Insurance Trust Fund. And they may not be used to administer for any other purposes. Any funds from the Social Security Trust Fund cannot be used for the Family Medical Leave Insurance Program. All right, well, let's talk about the taxes now. This is a self-funded program, And so there is a tax of 1/4% on each employee and employer that will go into the trust fund. So 1/4, 1%. And if you are self-employed, in that case, then you would pay both the employee and employer 1/2 of 1%. And again, railroad people have their own separate section of the US code. And same thing, 1/4, 1% for employee and employer. And then some other bookkeeping and just updating references to that. And as long as I got my screen shared, I'm just gonna, here's section 427, which is straightforward. The commissioner shall prescribe regulations necessary to carry out the subtitle. So let's talk about the taxes for just a minute. Again, 1/4 of 1% on a payroll tax. So let's say you make $50,000 a year. You would pay $2.50 per week into this, the Family Medical Leave Insurance Program. If you had a qualifying event where you needed to draw on it, you could collect 2/3 of your salary, or around $2,800 a month, for 4.5 months, or $12,500. So pay $2.50 a week in insurance, and you could collect up to $12,500 if need be. That's how it works. The tax will go into effect 10 months before the program starts taking applications. So as soon as you start paying your premiums, you can go ahead and get pregnant and then deliver the baby and go on family medical leave. Yeah. All right. Well, that pretty much concludes Family Medical Leave Act. So again, this is common sense stuff. This has been, it's been done in every other country. Again, we know it improves health outcomes. We know it means that babies, their infant mortality rate goes down. Like, if we want to reduce needless deaths, this is a way to do it. We can save the lives of 9,000 newborns a year, help them reach their first birthday. Again, this is good for employees. It's good for employers. It is common sense that we are one of less than 5 nations on the planet that doesn't require mandatory maternal leave, doesn't require paid maternal leave. And this 18 weeks is not nearly as generous as other countries. Countries like India, I believe, is 6 months. I believe the same for North Korea. These, and then some of the European countries have as long as a year. So 18 weeks would put us low on the scale, but right now we are an aberration with 0 weeks of paid maternal leave. We can do better. We got to do better. We have a duty to promote the general welfare, and paid family leave is a way to do that. So, all right. I think we're going to wrap things up there, and hope to see everyone tomorrow night when we're going to talk about, what are we talking about tomorrow night? Improving America's banking system. It'll be fun. Hope to see you then. Have a good evening.